Hello, my name is Dr. Donald Warne. I'm a family physician and I'm originally from Kyle, South Dakota on the Pine Ridge Indian Reservation. But I've been working here in North Dakota for about 10 years, primarily with the university systems. I'm currently the Associate Dean for Diversity, Equity, and Inclusion at the School of Medicine and Health Sciences at University of North Dakota. I'm also Director of the Indians into Medicine or InMed program, as well as Director of the Master Public Health program. And in my experience, I've seen all kinds of devastating health outcomes linked to commercial tobacco. I was honored to serve on the American Cancer Society National Board of Directors for a number of years. And when we look at the data, we see that American Indians, particularly in the Dakotas, have much higher rates of cancer and much higher rates of death due to cancer. And much of that can be attributed to commercial tobacco use. There are significant differences between commercial tobacco and traditional tobacco. Commercial tobacco has a lot of chemicals added to it that make it more addictive, but also put us at a greater health risk. It's those same chemicals that also lead to higher rates of cancer, heart disease, and other bad outcomes. Whereas traditional tobacco is a blending of holistic herbs, and it actually is medicinal. In my own experience, just thinking about the relatives I have who are traditional healers and medicine men, and also thinking about my ancestors, I really wonder what they would think if we were using commercial tobacco and all of the poisonous components in it and calling it traditional by using it in our ceremonies. Unfortunately for American Indians, we see higher rates of things like lung cancer and colorectal cancer and other types of cancer, but particularly the tobacco-related cancers. And when I think about this, I find it really heartbreaking because we do not have to have such high rates of disease, suffering, and early death as a result of these types of cancers because they are preventable. So in terms of tobacco control, the work has to be focused on preventing smoking initiation among young people, but also for those who want to quit. We need to make sure that they have the resources and services and supports needed to help people quit using commercial tobacco because of all of the health risks, particularly when we're looking at cancer. When we think about commercial tobacco addiction in American Indian populations, I think we have to look at this in a broader context and recognize that a lot of our challenges and when it comes to health disparities really is rooted in unresolved trauma. We have a lot of historical trauma, a lot of adverse childhood experiences. Unfortunately, many of our people went through boarding school experiences that were very traumatic emotionally and spiritually. And as an American Indian health professional, I see a lot of our people self-medicating, whether it's with alcohol or drugs or tobacco or even food. And I think when we want to address issues related to addiction and health disparities in our populations, we have to take a much more broad-based and holistic approach and be more intelligent about this and recognize that we need to focus on preventing trauma, preventing adverse childhood experiences, and promote wholeness and wellness in our families and in our communities. In the long run, that's going to be our best strategy to address addiction, including commercial tobacco addiction. As tribal members and as tribal leaders, we do have the opportunity to make an impact on commercial tobacco in our communities. In other populations around the country, we do see tribal tobacco taxes. And when tribes raise the price of cigarettes, we see less smoking, and the revenues that are generated can be reinvested into public health and health promotion activities. There's many good examples of that all over the country. And it's been a proven technique to decrease cigarette smoking when you raise the price. So a tobacco tax at the tribal level is an expression of tribal sovereignty, and it's absolutely our right to do that, and we can have an impact in our communities. In addition, at the state level, we unfortunately have among the lowest tobacco taxes in the nation here in North Dakota, and it's a proven method to decrease smoking when we have a higher tobacco tax. And if you have less smoking, you have less suffering and less death from tobacco-related diseases. So it's very easy to draw a straight line between legislation and better health outcomes and saving lives. So I'm hoping we have the opportunity to move in that direction here in this state, but in the surrounding region as well, because it's a proven way to decrease smoking, decrease suffering, and to save lives.